So why don't we get things started? I want to welcome everybody. We are excited to be hosting. I'm Elizabeth Eleni with Schneps Media, and this is our Straight Talk webinar series. And today we are so excited to introduce Avenue Orthodontics to us. They are going to be presenting something very important to all of you. But to let you know who we are, Schneps Media, we are one of the largest local media companies with over 70 newspapers, magazines, and websites all around Queens, Brooklyn, Manhattan, the Bronx, Westchester, and Long Island. And we are still excited to be serving the communities that we serve, even through this difficult time and keeping people connected. So today we're thrilled to be able to welcome Dr. Abraham and Dr. Eleni from Avenue Orthodontics and invite them to talk to us about orthodontics during quarantine. We're going to learn tips on how to self-care during quarantine, from braces to Invisalign, and to make sure that quarantine does not ruin your smile. So we're going to get started with Dr. Abraham, and he is going to walk us through some important details, and we'll certainly get to the Q&A as well. So take a look at the chat function. You can ask questions throughout, and we will be sure, if it isn't addressed already, to address it in the Q&A after Dr. Abraham and Dr. Eleni have an opportunity to speak with us. So I welcome you, and please take it away.
So just to say it again, I'm Dr. Eleni. This is Dr. Abraham Shaheen. We're partners and husband and wife. And we practice in Whitestone, New York, and as well as in Roslyn with Dr. Stuart Grauer. So we're really excited to be able to do this. Thank you for joining us. So yeah, and in keeping with our divide and conquer strategies, we're going to be we have a 3-year-old and a 6-month-old. So we're going to be splitting this up a little bit in case somebody wakes up from their nap. Like Dr. Eleni just mentioned, we've recently had the privilege of partnering with Dr. Stuart Grauer in Roslyn. Dr. Grauer has been practicing in the North Shore area for about 30 years. His practice is Grauer of Avenue Orthodontics, hence the sign up there, Avenue and Grauer. So not to confuse anyone, but it's going to be under the Avenue Orthodontics umbrella. A couple things we just wanted to point. A lot of these tips that we're going to give are just general tips that your orthodontist has probably given you at some point or another. We're not going to be in a pandemic forever. We're not going to be in quarantine forever. So we wanted this to be something that you guys could use. You know, when the kids go to summer camp, if you travel for the summer, if you go away on a trip. So a good amount of this material is just orthodontic self-care anytime. It could be on Sunday night when the doctor's office is closed. Some of this information we're going to give, though, is very specific to these times and very specific to how Dr. Eleni, Dr. Grauer, and myself treatment plan. So please consult with your orthodontist. Make sure you're following their treatment plan. I'll do my best to sort of let you know if I'm giving advice specific to our patients, to Avenue Orthodontic patients, but please make sure you follow up with your doctor and follow their treatment plans. So with that, let's get started. Aligner patients. So aligner patients, there are a lot of brands out there. Of course, everybody's heard of Invisalign. Anybody that has an aligner, and it looks like right here, this clear plastic material. So for all our patients, this is the easy one because there are less moving parts with aligners. So you will be able to continue with your treatment. This is where we want you to stay with your prescribed wear. So generally speaking, at Avenue Orthodontics, we prescribe our aligners for weekly changes. If you are wearing any elastics, this is the part where it's a little specific to us. When your next scheduled appointment was supposed to be, let's say May 15th, you had an appointment with us, we're going to go through a series of steps for you to have an online consultation with us, elastics or rubber bands, and so we can update you on your elastic use. If you need, and then prior to your appointment on a week-by-week basis, we are going through all of our patients and we are confirming your addresses. We're mailing your aligners, we're mailing your rubber bands, so your treatment is going to continue uninterrupted. Funny enough, today on one of the community pages, somebody mentioned that they were out of aligners with another office, and they needed a scan. Just so you know, you are able to get more aligners without another scan. So for our patients, obviously notify us. And if you're a patient of another practice, just make sure to let your orthodontist know you're running out of aligners, and they can order you more aligners without having to take another scan, which is wonderful. Okay, so tools you're gonna need for these times. We decided to go with a goofy picture here. This is Dr. Grauer and our team in Roslyn for Halloween. Guys, these are the general, these are general enough instructions that you can take year round. In fact, a lot of this material came from the American Association of Orthodontists, so great material to use year round. Always make sure you have some wax. You can get that from usually any pharmacy, or you could order it online. If you want to go a little fancier, I know it's a really goofy name, but there's a product called Gishido. Think of it as wax, but it's a two-part. So when you squeeze it out of a syringe, it starts off nice and soft, gives you a chance to kind of place it where you need it, and then it hardens on there, which is wonderful because it could stay on, for up to 24 hours without sliding. Dental floss, sterile tweezers, nail clipper for the jewelers out there, anybody that makes homemade jewelry. A small wire cutter works great if you're handy and have one in the garage. Q-tips, salt for salt water, an interproximal brush. Again, all these can be purchased on Amazon or through multiple venues. A toothpick and a pencil with an eraser tip. So now that we got all those, I'm going to bore you a little bit, and we're going to go through some parts of the braces, just so that when we're throwing around terms, we're all on the same page. So generally speaking, your braces are made of a few components. The first one that everybody's familiar with is the ligatures. Those are usually colored ties. You can get them in clear or silver, but those are the ties that hold the wire to the braces, to the brackets. And as I mentioned, a lot of times those come in colors, so you can't really miss them. Highlighted in yellow right now is the arch wire. So the arch wire is what kind of interfaces with the bracket so it can move the teeth. And that's held by those ligatures that we just mentioned. Then you have the brackets. Those are the braces that are glued on to the teeth. Then we have, in some cases, metal bands. Those go around the tooth. It's just like a ring that I'm wearing on my finger that goes around your tooth. And finally, you have the rubber bands. Again, it's highlighted right here, and you can wear them in different directions, and there will be hooks, usually to where your orthodontist wants you to wear your rubber bands. Once again, similar to our Align patients, our Invisalign patients, and aligner patients, if you are wearing rubber bands or an appliance or a retainer, please continue wearing them as prescribed. And then we will contact you or contact us for a virtual consultation. No reason to stop your treatment. We can continue your treatment during this time. And sorry, it goes to without being said that this is for our patients now, as far as continuing your prescribed rubber band wear. So we covered the parts. Let's go with the easy part. So one possible emergency we can have is food caught between your teeth. A lot of times that's popcorn kernels. That's usually the big offender. It gets lodged there. It's really hard to get in there. It's really could be more of an embarrassment than an emergency. Easily resolved. Just grab a piece of floss, thread the floss right here from under the wire over to the other side, and just go up and down like you normally floss without pulling too hard up and distorting the wire. The other potential problem that we can have is a ligature coming off. Remember, the ligature are the colored ties that go around the teeth. So you can grab a tweezer, grab it on the loose end, and just tie it over the bracket, and then you're back in business. Mouth sores, you can kind of see sometimes down here, sometimes for one reason or another, the lips or the cheeks are not really happy with the brackets. Make sure you use a saltwater rinse. That's sort of the gold standard here. You could get a peroxyl rinse. That's a brand. Colgate makes it. and rinse. That's going to now help with the irritation. And on top of that, we want to stop the offender. So, generally speaking, if you feel like there's a hook or something bothering you right here, and it keeps cutting on the lip, make sure you grab that wax, or like we mentioned, the gushy goo, ball it up and flatten it right on the offender right there. Occasionally the wire will slide from side to side. If you're able to grab it with a tweezer and slide it back around, that's great. If not, that's where the wire cutter and or the nail clipper or a cuticle cutter, something nice and sharp. If you have gauze, that's a great idea to place it there, just so the wire doesn't travel back on you. And get as close as possible to the bracket. I'm sorry, I slipped ahead. Get as close as possible to the bracket. So the bracket is the braces glued to the tooth, and you can cut it. And finally, sometimes the brackets themselves, so those are the braces that were glued to the teeth, will come loose. So that's showing you a bracket that came loose. That's where you grab a toothpick or a tweezer. Now we're doing the opposite of what we did before. Before the ligature came off, we'll grab a tweezer and put it back on around the bracket. This time around, I'm going to grab a tweezer or a toothpick, take the color tie off, and then we're going to grab the bracket with a tweezer and just remove it. If you are a patient of ours or any practice, right now the guidelines are, like, let's suppose you have that wire sticking in the back. If you or your child are experiencing discomfort and you're not able to fix it yourself, we can see you for orthodontic emergencies, and we're able to clip that wire for you. So just be sure to contact your orthodontist if it's something that you're not able to do, or contact us if you're our patients. Last but not least, this is the contact your orthodontist part. If you have a palate expander, which is right here, if you have something called the lower lingual holding arch, a Mara, a Forces, these are all appliances that do more skeletal corrections. So these are appliances that are a little, more cumbersome to fix. This is something that we advise you guys to call your orthodontist, and we will direct you what to do. There's not an easy hack for that one. We're going to show you a little video now, just a little tutorial on what to do for all the things that we just mentioned. That's for a wire that maybe slips out of the bracket. You just grab a tweezer, slide it back in. On the top there, a wire that's sticking out, we can either cut it or add a little bit of wax padding until your orthodontist can cut it. This is an access wire that you have access to, and showing you how to cut it with a nail clipper. And finally, these are ligature wires. These are little steel ties that we tie the bracket to the wire. Some things they poke out, you can grab the end of a pencil and put it back in.
Dr. Abraham, I have a question. Just for people that are helping either their children or helping their partner, what or any of this, does it cause pain? Are these things that we should be warning them that's going to cause pain, or are these things pretty painless to the patient?
So generally, that's a great question. So in these examples that we just gave, a loose bracket is not necessarily an emergency. It could be annoying, but this is not necessarily going to cause pain. It's going to slide around when when they're eating. If it's annoying, we advise you just to remove the bracket. It may delay treatment a little bit, but it's not something to sort of run to the office for, especially given the conditions that we're in right now. Again, pain is subjective, but something like this could cause irritation. This could cut the gums, or it could cut the inside of the cheek. This is something that if the parent or the patient cannot take care of themselves, this is a good idea to call us, and we can do that for you. Or like this example showed in the video, this is the one where maybe place some wax on there until you could get into the orthodontist's office.
So you can leave it loose. If it's loose, you can just leave it?
Absolutely.
Can we go back? I just wanted to interject. So if you have a bracket that breaks in the middle, like this bracket is in the center, it's sort of like bordered between two other brackets, so it can slide back and forth and sort of stay there. But if it's a bracket that's at the end, that kind of, where's that one? Let's say one of the last brackets break. Okay, that's a little different because now that bracket can kind of slide around on the wire. you can take a tweezer and take that bracket and just slide it off and then clip the wire, or you can clip the wire and the bracket will come off with the wire. So that's another thing that's a little different based on the location of a broken bracket.
Great, that's helpful.
And all these things we don't expect you to do yourself. I mean, we're obviously trying to show you how to do yourself. If you are a patient of ours, that leads us to this slide. We're here for you. So we can either guide you through it, and the way you do that is if you need instant help for our patients, please, this is a little specific here now, make sure you call us and we'll send you a link. It's something similar to Zoom. It's HIPAA compliant, but you can use that link to just video chat with us. Now, HHS has loosened HIPAA laws. So even if your orthodontist does not have some of these HIPAA compliant video chat apps or whatnot, you can just do this on FaceTime. This is a temporary measure they took, but there are a lot of avenues for you to communicate with your orthodontist that a couple months ago we were not allowed to do. We couldn't just jump on our phone and do FaceTime with you guys. So a lot has changed. Now, if this is just for, we want, like we mentioned, we want you to just continue with your treatment. We don't want this to, you have a million things to worry about. We don't want this to disrupt you. So let me just go to this slide. I'm gonna just show you real quick. We made it quite easy. You go to our website, you go to schedule online appointment. Right down here, so obviously today we're doing this webinar, so we blocked off the whole day. But let's say, that these are the available times for tomorrow. We enter our info. You just enter your email, your phone number. Please make sure you enter your phone number, and down here, the send text reminder. What'll happen is once you're done with that, you'll make the appointment. You're gonna get this confirmation email, and in this email are 3 steps. Step 1 is how to take smile selfies. Step 2 is to email us a smile selfie. And then finally, the last step is at your appointment time to click on this link. It's browser-based. You don't have to download an app. You don't have to do anything. You just click on the link and we'll jump on a video call just like this. And it's encrypted. It's HIPAA compliant. We don't have to worry about any of this stuff. This is going to be available, through pandemics and beyond. Now, this video that I just mentioned is available on YouTube. We're about to play it for you guys in a second. This is a great tool for anybody, regardless of where where you seek your orthodontic care, because this is just a great way for you to communicate with your orthodontist to just, if there's something going on, like, hey doc, I'm not sure about this, it's a great way for you to take a few snapshots since we're all stuck at home and can't, for some, maybe you don't want to go into an office to start with. So this is just a great way for you to communicate and email to your orthodontist. So we're going to play this video.
Hey there, we wanted to take a couple minutes to walk you through how to get some great photos for your virtual visit. The first tip, you'll just need to use a smartphone, something you already have around your house. Secondly, these photos are easier to get if you use a friend to help you. Selfies can be tricky, and please don't take them in a mirror as they throw off the left and right. The third step is that good lighting is key, so find a bright room or use the flash feature on your smartphone. The fourth step is to get quality photos. Get in close, make sure they're in focus so that your orthodontist can come up with an accurate diagnosis. So what we'll do now is we'll walk you through the 8 photos you ideally need. The first 3 are headshots. You just want to get the head and the shoulders. The first is a frontal relaxed photo. Just look straight ahead, sort of like you're at the DMV. The second photo is going to be frontal smiling, so the same position with a nice natural smile. The next photo is going to be a profile shot. So Anna is going to turn 90 degrees to her left. She'll take her hair and she'll pull it behind her ear so we can see her jawline and her ear. The next 5 are inside the mouth, a little bit trickier, and there's 2 things you need to do. First, wash your hands thoroughly. Second, you can find some plastic spoons around your home to help move the cheeks out of the way. The first photo is the center photo, just of the teeth, and make sure you're biting down normally as you take these photos. The second photo is going to be the right side, so leave the spoon in on the right side. Keep the camera closest to the spoon. And then we'll do the left side. So she'll take the spoon, put it in on the left side, and you get a great photo just like that. The last two are a little bit simpler. The first will be of the upper teeth. So chin up, open wide, where you can see the biting surface. The final photo is of the lower teeth. Tilt your chin down, try to keep the tongue out of the way, and we'll snap a good photo right there. With those 8 photos, what you'll then do is you'll upload them via your orthodontist website. If you have any questions about that, reach out to your orthodontist for clarification. Thanks for watching.
So like we mentioned, guys, this is a YouTube video. So it's, you just, I believe it's Neon Canvas is the YouTube channel. But if you just Google, you know, taking pictures for your orthodontic virtual consultation, you can also find it.
That's very simple and helpful.
Hey there. We wanted to take a...
I don't know why it's... Yes, it's... And what, you know, like I mentioned, this is something that's going to be great year round. I mean, you can... Hopefully we go back to normal and your child can be away in camp, or, you know, it's the holidays and you go on vacation, whatever it is, and you're not sure what to do. So these are going to be great tools. You can, you know, take those, snap those shots, email them to your orthodontist, email them to us if you're our patient, and say, Doc, what do we do here? And so long as you have that toolkit that we just mentioned before, you're set anywhere you go. That's it. We're ready for questions if you have them. And thank you so much for listening to us.
That's terrific. Thank you so much for that, you know, information that really can help empower people so that they don't feel like they're lost with their care. Obviously, it's very important to speak with your doctor that you're working with. But it seems that you've really put together a wonderfully easy way for people to deal with their orthodontic issues and problems when they're right at home, which is important, because some of this does, like you said, with those, with the wires sticking out, can cause quite a bit of discomfort. And being able to take charge of that is important. So your locations are in Roslyn and in Whitestone, which
Correct.
is wonderful. What else can you tell us about keeping things, oh wait, excuse me, we have another question coming up. Do you have any advice on how to keep clear, traditional braces clear?
I think, you know, clear braces, it's more or less the same way as regular braces. Clear braces tend to get they tend to show things a little bit more. So for both types of braces and including your aligners, you have to really maintain your oral hygiene. I think that's probably one of the biggest things. If you're not brushing, flossing, keeping your teeth clean, all those things all the stuff that we're putting into our mouths is gonna bind to the teeth, bind to the brackets, into the ligature ties, those little color ties, and it's gonna really make it show and start to discolor the ties that go around the clear brackets. That's usually what you're seeing. The braces themselves don't stain per se, it's more that the ligature tie itself does. So you want to really keep things clean. You should also watch what you're eating. You know, that's another thing. So if you're eating things that are really strongly pigmented, if you're drinking a lot of red wine, curries, turmeric, all those things will actually bind to the ligature tie and also make your clear brackets start to turn yellow.
But, you know, I mean, that's a great question too, though, because unfortunately right now, you don't have a choice to change those ties as often. There are some great products coming out lately. One product that is we really recommend, we've been recommending more and more. I actually pulled it up on my phone. It's called white foam. Again, you can find this at a pharmacy. You could find this. Am I doing a decent job? Yeah. It looks something like this. It's called white foam. There's a hydrogen peroxide in there. It's really great, especially let's say you got on your last aligner, for some reason your orthodontist cannot send you more aligners, or you mentioned you have clear brackets. It's a low concentration hydrogen peroxide foam. You apply it right into your aligner, or you apply it right onto your braces, and it brightens and lightens everything. So you know, I'm not sure how long it's been on the market, maybe in the last year or so, but it's been a game changer, especially for patients with clear braces. So I highly recommend you try that out.
Great.
And again, we have no interest in any of this. This is just stuff that, we recommend for our patients.
Thank you for that. When do you think that your offices will open?
Right now, we have a tentative date for June 1st, but we have to kind of follow the guidelines that are being presented to us.
And it's a state-by-state thing. So
Exactly.
If you're outside of, for some reason, if somebody's watching in another state, some states have already opened. My understanding is there's a couple states that really never quite closed their dental offices, or maybe did for a short period of time, but they've been open. So in New York State, we're listening to Governor Cuomo, as you all know, or maybe know. He has kind of set a tentative date of May 15th, but dentists and professional services were not part of that. There's also, you just noted we have an office in Roslyn and Whitestone. There's a possibility in New York State, at least, it's going to be a county by county issue. So maybe some counties in upstate New York, their dental offices will be open maybe before we are in Queens County. So we're waiting, like all of you, and hoping that it'll be sooner rather than later, and of course it's done in a safe manner.
Wonderful. How are you communicating with your patients at this time?
So we have somebody who answers the phones every day from 9 to 4. That started this week because initially we had it set up where there was a recorder, either left a message or the recorder allowed you, if you had, you basically said, if you have an emergency, press 5. That would forward your call to my cell phone or Dr. Eleni's cell phone. That in the last weeks, got to be a little much. So from 9 to 4, somebody answers the phone in our office. All other times, 4 p.m. till 8:59 a.m. The phones are set up to come to our cell phones. So if our patients need us, again, this is not corporate dentistry, as you can see. This is as mom and pop as it gets. You have access to us at any time. We check our emails for the time being. So info@avenueortho.com is being checked 90% of the time by Dr. Eleni or myself. And I'm sure, maybe a handful of patients a day, we end up arranging, if they need us. We have met patients in Whole Foods parking lot, North Shore Farms parking lot, their front porch, our front porch. So, we're very flexible. We're meeting patients where they're comfortable and where it makes the most sense to take care of. But those are the patients, if you remember that slide I showed, they're the ones that maybe it's something that can't be done at home. 90% of what we're doing, we can jump on a video call and walk you through it. And a lot of times patients are taking care of it on their own because a lot of this material we've put out in our office. But we're available. We're here.
Right. How much of this do you think is going to continue after the quarantine is over? Are they planning with the HIPAA laws? Is this something that's going to stay this way, or are they going to change? And is that unavailable?
That's a great question. As of today, in theory, nothing has changed. So as of today, for example, the states that have opened, they're asking their dentists to follow and please, once again, we're not experts in this. So we're speaking as, sort of two private practice dentists who are just kind of listening to the experts. So I just want to put that out there because I feel like these days everybody's a COVID expert and putting out material that may or may not be true. So the guidelines that we've had, if you stop and think about it, have always been very stringent because dentists in general, we're a few inches away from your mouth. So we've always had very strict and stringent requirements that we have. So our PPEs, personal protective equipment, and our safety guidelines have not changed. There has not been a mandated change to them. There are some states who opened, and as I said, follow the rules as they were. And there are some states that are opening that are putting a couple caveats. So for example, when we open, regardless of what happens, we are going to practice as best as we can social distancing in the sense that we're going to reduce the amount of patients we see per hour, 20, we block usually in 15-minute increments. We extended it to 30-minute increments. So we're just going to see less patients, space patients out. We're asking patients You know, if it's one child from the family, you know, don't bring the 3 other kids and grandpa and grandma and dad and the whole family into the waiting room. You know, one parent with one child. So there's going to be some common sense recommendations that each office is going to make. But generally speaking, as I said, right now the guidelines are to continue to follow all the protective measures we already took as dentists, and just to continue that.
That's really an important point. Can you share with us what some of those things you've already, because honestly, when I think about going to the dentist, I really, before all of this, I never thought about, you know, what are the things that they're doing that keep everyone safe from passing germs. So would you share with us a little bit about those things that you already are doing?
Yeah, I mean, you know, I mean, when we went to dental school, we learned that when you're seeing your patient, you're basically treating them as if either you're sick or they're sick. You want to basically assume that there's something that could be contagious that could get passed from patient to doctor or doctor to patient. So it's actually mutual. So we always have the surgical masks on. We should be better about it, but usually eye protective wears, but we'll be doing that even more now. Gloves, and keeping everything sterile and clean, wiping down chairs between patients. We always sterilize our equipment. That's always basic. There are going to be some changes to the front desk now, though. We're going to have, you know, parts that are going to be more covered and things like that. So the basic stuff, plus maybe a couple of more detailed things.
Yeah, I mean, there's been a shift, generally speaking, in the past to make the waiting room as sort of welcoming as possible, right? Make it like a living room.
Right, like we have a PlayStation and things like that.
So, you know, unfortunately, the games will have to be covered just temporarily. But as you know, once you're in the operatory, like Dr. Eleni mentioned, I mean, if maybe the next time you're in your dentist's office, take a look. I mean, everything is there single use. Everything is there plastic. What's not single use, you'll notice, you know, it's coming, it's being sterilized. Once it arrives in a sterilized bag. When it gets placed, it's placed. In addition to that, there's, you know, plastic coverings over it. So, you know, can you in any venue, generally speaking, reduce, you know, everything down to 0? No, but Dr. Eleni mentioned it, you know, perfectly, which is we've been practicing for years as a profession, assuming that either ourselves or the patient has something that could be transmitted, you know, one way or 2 ways. So we've been taking these precautions for years as a profession, and we continue to take them. You know, there are some things that we're considering doing, just, you know, for peace of mind. You know, just as an extra, like, and again, it was in the soft spots, you know, like the reception area. We're going to add like a filtration system that, you know, maybe we didn't have before. We're going to block off certain parts of the office that, you know, unfortunately made the office fun, like, you know, in our Roslyn office, for great timing. Mid-February, we bought arcades, you know, for the kids so they can play arcades. You know, we're going to block that off until, you know, the pandemic is over. But these are completely separate from, you know, what we do back in the clinical area. These are more sort of fun, trivial things that we had in a waiting room that unfortunately for the time being, given the times, we'll block off.
That's really great information. Thank you. You know, you kind of take it for granted before pre-COVID, but now it's something that's, you know, important for us all to know and to be able to feel safe. But this has been wonderful. You've really given a lot of great tips for people to be able to take care of their braces and Invisalign during this COVID time, and to make sure that they could still smile beautifully even during a quarantine. So I thank you very much, Dr. Abraham and Dr. Eleni of Avenue Orthodontics. And they can be reached by their patients at avenueortho.com. Obviously, if you're not working with another orthodontist, they are wonderful people. How are you, you know, before we say goodbye, let me ask that question. How are you handling anyone who's interested as a new patient right now?
So that's that website. So, you know, you go to our website, you schedule, well, you can call us and we can schedule it for you, or you could do it on your own. You can go to our website, click that link for the virtual visit. If you remember, you get that confirmation email with that video on how to take your own photos. You submit that. I want to caution patients, you know, I mean, The proper way to diagnose a patient will always be, you see them in person. We have to, we always give the analogy, when we were in high school, and it seems like forever ago, before you joined the soccer team, you had to get a physical from your doctor. Make sure you're healthy enough to run, the soccer field. Well, we got to make sure your teeth are healthy enough to be moved. So, we do need to communicate with your dentist. But more importantly, you can go online and we can get a conversation started. We can maybe do about, sort of 70% of the traditional process virtually right now. So we can start a conversation, discuss approximately how long the treatment will take, some goals, some expectations of, what we can and cannot do with a smile. There's a lot of things we could do virtually. The final treatment plan, so the final steps, we will have to wait until we see you, because like we mentioned, we need to make sure we have updated x-rays, got to make sure your teeth are healthy enough, the bone is healthy enough. So that will have to wait until we see you in person. But we've seen quite a few patients, and it's more like this, right? It's getting to know each other, getting to know what you expect, what you're looking for, and we can give you some ideas on where we can go and what kind of smile you can have at the end.
Wonderful, wonderful. It's nice to know that perfecting your smile does not have to go away, even with everything that's going on.
No, not at all. And a lot of people have a lot of, some. We don't feel it at all with two kiddos and trying to run a practice virtually. But some people have some time on their hands, so this is a great time to jump on that virtual consult. And it's you can do it from your couch and kind of see your orthodontist. What better time to do it that way than to be able to do it from your couch?
Absolutely. Well, kudos to you for making it so easy for your patients to be able to get your help. And thank you so much for giving this great information to our attendees. Again, this is Avenue Orthodontics, Dr. Abraham and Dr. Eleni, and they can be reached at avenueortho.com. Thank you so much for your time. We appreciate your all being here and joining Schneps Media Straight Talk. And we look forward to seeing you again soon. Have a wonderful day.
Thank you, guys. Thanks for joining. Thank you, Elizabeth.
Thank you.
Okay,
Bye-bye.